So the topic is lysosomal storage diseases and the glycogen storage disease. So first we are going to discuss the lysosomal storage disease. All the lysosomal storage diseases are autosomal recessive except Fabry disease, which is X-linked recessive. So I'm going to discuss few points which are important in respective diseases. The substance which I've written in blue is the accumulated substance, and the enzyme in red is the deficient enzyme. So in Fabry disease, the deficient enzyme is alpha galactosidase A, and so the substance which accumulates is ceramide trihexoside. There is a classical triad seen in Fabry's disease, which is a child with pain in hands and feet, also known as peripheral neuropathy. The other thing in the triad is the lack of sweat and hydrosis, and the third thing is angiokeratomas. It is one of the skin findings seen in Fabry disease. The person suffering from this gets into progressive renal failure and a variety of cardiovascular diseases. The other lysosomal storage disease is Gaucher's disease. It is the most common lysosomal storage disease of all. The deficient enzyme is glucocerebrosidase. So the substance which accumulates is glucocerebroside. It is classically seen in child of Ashkenazi Jewish descent, and there are various types. According to the severity, there are various types. The information here is not as important to remember, but just these are the types C. Also, there would be splenomegaly seen on examination, anemia, bruising because of the low platelets. Classically, joint pain and fractures, bone crisis is seen. And there are specifically Gaucher cells, which are lipid-laden macrophages, which resembles crumpled tissue paper. This is one of the important information to take away from this. So yeah, this is Gaucher's disease. The third one is Krabbe's disease. Here the deficient enzyme is galactocerebrosidase, and so the accumulated substance is galactocerebroside. It is classically seen in child of less than 6 months, but the thing we need to remember here, it has only neurological symptoms. Okay, so there would be progressive weakness in the child, developmental delay, eventually floppy limbs, loss of head control, abnormal reflexes, optic atrophy, classically death within 2 years. There are globoid cells in the neuronal tissue, which are the globe-shaped cells, and also we can see thalamic hyperdensity. So the thing which we need to remember here is the deficient enzyme. We need to differentiate here. It is glucocerebrosidase in Gaucher's and galactocerebrosidase in Krabbe's. Also in Krabbe, we have only neurological symptoms, while in Gaucher's we have splenomegaly, anemia, bruising, bone crisis, etc. Now the fourth one is Niemann-Pick's disease. The deficient